Welcome to this unit on engaging the public, providers and patients. By the end of this unit, you will be able to describe ways to mitigate and manage risks to trust in AI. Engaging the public, providers and patients. Effective use of AI for health requires building the trust of the public, providers and patients. Public engagement and dialogue are ways to ensure AI for healthcare meets core societal expectations, helping to build wider trust and acceptance. Public dialogue also uncovers societal views on the ethical dimensions of AI, its design and uses. Public debate with regard to human rights and biomedicine is underlined in Article 28 of the Oviedo Convention. Patient data for AI. A critical concern for the public is how data is collected and used for AI. For example, data protection concerns in the United Kingdom have been addressed through public debate and dialogue. The health data research used workshops to provide a forum for participants to discuss their expectations and concerns about use of patient data in AI. Before these workshops, 18% of participants considered it acceptable to share anonymized patient data with commercial organizations for reasons other than direct care. After the workshops, the proportion had increased to 45%. Individuals who express positive views considered that contributing data was a value exchange with a societal benefit. They wanted the NHS to benefit from their data. They also considered it acceptable for commercial companies to have access to their data, provided that the benefit returned to the public and that the NHS administered the data for the public benefit. This benefit should include what new insight companies glean from AI-learned patterns and trends. The United Kingdom Academy of Medical Sciences also found through meetings and workshops that ongoing engagement with patients, the public and healthcare professionals, including via co-creation, will be critical to ensuring new AI technologies respond to clinical unmet need, are fit for purpose, and are successfully deployed, adapted and used. The Academy conducted a public dialogue on the data-driven future to understand awareness, expectations, aspirations and concerns about future technologies that would require patient data to be accessed, analysed, or linked for clinical diagnosis and management. The respondents considered that any new use of data must have a proven social benefit. An appropriate organisation, such as the NHS, should oversee the data and administer it for the public benefit. Public trust. Steps must be taken to build the trust of providers and patients who will increasingly rely on AI for routine decision-making in healthcare. The willingness of patients to rely on AI may sometimes be much lower than expected. For example, in a study conducted by HSBC Bank in the United Kingdom, 8% of respondents said they would trust a machine offering mortgage advice, while 41% said they would trust a mortgage broker. Trust can be critically damaged if scandals emerge that may undermine patients' economic, personal, or physical security. For example, after the Cambridge Analytica scandal in 2019, an estimated 15% of Facebook users surveyed indicated they would reduce their use of the social networking site. Trust could be eroded more quickly and severely in the domain of healthcare if similar scandals or abuses of trust emerged into public discourse, which could destroy public trust overnight. Lack of trust in technologies could also create significant divisions in a healthcare system where, for example, older patients might be unwilling to adapt to and use new AI technologies, while younger patients might be more amenable. Mitigating risk. One means of mitigating and managing risk would be to allow healthcare providers and developers to test a new AI product or service in a live environment in a testing facility with safeguards and oversight to protect the health system from any risks or unintended consequences. Known as a sandbox environment, These testing facilities could allow assessment, certification, and validation of AI. For example, the EU's Draft AI Act has foreseen for them. In limited circumstances, testing facilities could build a regulatory sandbox. However, they may only be appropriate in countries where new healthcare products and services and their specifications are subject to formal regulation and data protection regulations. Examples of the use of regulatory sandboxes are in the United Kingdom's Care Quality Commission and by the Singapore's government to test new digital health models. A second approach to building trust and facilitating a graceful transition of healthcare is to redesign training programs for the health workforce and to improve general education. Improvements in general education would include primary education in science, technology, and mathematics. A third approach is the use of human warranty, whereby developers of AI technologies work directly with providers and patients in patient and clinical evaluation at critical points in the development and deployment of the technologies. Human warranty can ensure meaningful public consultation and debate. WHO recommendations. WHO recommendations for impact assessments for AI for health are: 1. The public should be engaged in the development of AI for health in order to understand forms of data sharing and use, and to comment on the forms of AI that are socially and culturally acceptable. 2. Training and continuing education programs should be available to assist healthcare professionals in understanding and using of AI. You have now completed Unit 2 of Module 5, Building an Ethical Approach to the Use of AI for Health. In the next unit, we will look at impact assessment.